It's Patrick Hutzel from intensivecarehotline.com with another quick tip for families in intensive care. So we have a membership for families of critically ill patients in intensive care, where you can become a member as well, and we answer all questions intensive care related in our membership for families of critically ill patients in intensive care. You can get access to our membership if you go to intensivecarehotline.com, if you're clicking on the membership link, or if you are going to intensivecaresupport.org directly. Now, today I want to answer a question from one of our members, and I want to read out our member's question and answer it so you can actually see what questions our members have and how we answer them. It's really showcasing what you get in the membership, but also for anyone, you know, that's just curious about what we do at intensivecarehotline.com. It'll give you a better sense. Now, hi, Patrick, and so I'm reading out the question from our member. Hi, Patrick and team. And this is a member who had their dad in ICU for many months. So here's what she says. My dad has been off all antibiotics since Sunday, and they've done another blood draw that they're doing a blood culture on to see if nothing comes up, I'm assuming. Right now, his white blood cell count looks good, and he still has slight fluid in his lungs. He's been responding more with a passive speaking valve, and yesterday was the first day he had in most of the day with maintaining blood oxygen levels on his own. My concerns are he still seems very sleepy throughout the day and after therapy, which he only gets 1 hour a day, 3 days a week. He does respond to us with answering our questions, but is it common that he doesn't know how to speak well after having his tracheostomy, or is it also his brain injury causing confusion? Could he still be slowly regaining consciousness as well? He isn't completely out of his arm restraints, but they have suggested he go without them while my mom is with him. He is scheduled to transfer sometime around the 20th of December, and they're suggesting a nursing home / LTAC that has a short-term rehabilitation program. My concern is that it is a nursing home LTAC though, and I don't want them to treat him like we want him there long-term. I did find a place that's an inpatient rehabilitation center only, and it has a respiratory section that takes tracheostomy patients. I just wondered if he would have to qualify in other areas to be able to get into a facility like that once. Thank you. Well, thank you so much for sharing your dad's current progress. I mean, you mentioned that he has been off the antibiotics since Sunday and that they have done a follow-up blood culture to determine if the bacteria has been effectively cleared after the course of antibiotics. We hope that he remains free from any further infections. It's good to know that he's been responding more and more with the passive valve, and we hope that he's been maintaining good oxygen saturation of above 95%. You mentioned that he's sleepy throughout the day and after therapy, and this may be due to a range of reasons. His medications potentially inducing daytime drowsiness, the quality of his sleep during the night, or it might be related to the effects of his injury. And also, you know, when someone has been in an induced coma for a prolonged period, there just seems to be delays in them waking up, unfortunately. You know, the medications, therefore, could potentially inducing daytime drowsiness, the quality of his sleep. You know, if it persists, it would be helpful to review his latest blood test results, particularly like his ammonia levels and potentially also his carbon dioxide levels. His CO2 levels could also make him sleepy. Additionally, checking, you know, blood gas results, that could definitely provide insights. A follow-up with a neurologist is also important to reassess his neurological status and determine any necessary adjustments to his care plan. It is not uncommon for someone who has undergone a tracheostomy and is recovering from a brain injury to experience difficulties in speaking and cognitive function. This is the reason why it is important that he is in regular sessions with physical therapy and occupational therapy, as well as speech therapy, as these allied health therapies play a crucial role in supporting his recovery journey. Regarding his arm restraints, it's good that the medical team has suggested removing them, especially when your mom is present. This approach might aid his comfort, mobility, and overall recovery process. Otherwise, it is important to always check for any blood circulation issues in the area of restraints to prevent any potential negative effects. Considering your dad's complex medical situation, he meets the criteria and he will benefit from the inpatient rehab center that specializes in handling patients with tracheostomy and recovering from brain injuries. It's important that he will be transferred to a facility that aligns with his specific needs for his safety and recovery. You can request from the medical team that they consider transferring him there in his present state and per the family's preference instead of LTAC. I really hope that helps. If you have any other recent progress reports, you can send it through to us so that we will have a clinical insights based on the recent results of his blood works and any diagnostic exams done, doctors and nurses' documentations, and determine his next course of care plan. Please keep us updated and give us as much information as possible so we can guide you in the right direction. You will absolutely need to seek a facility that can look after his tracheostomy, but even better, can they move towards taking out the tracheostomy here and then get him onto rehab? Your life will be so much easier. Then going home will also be a lot easier. So I hope that helps. And, he's in the best place right now, even though it's not making as much progress as he should. It's much better than an LTAC or a skilled nursing facility. Whilst I'm all for home care with intensive care at home, it's probably not quite there yet. And, but that is something you should also consider. So I hope that helps. Now, if you want to become a member in our membership for families of critically ill patients in intensive care, and you want your questions answered like we have done here, you can get access to our membership for families of critically ill patients in intensive care at intensivecarehotline.com by clicking on the membership link. Or you go to intensivecaresupport.org directly. Now, in the membership, you have access to me and my team 24 hours a day in the membership area and via email, and we answer all questions intensive care related. I also offer one-on-one consulting and advocacy over the phone, Skype, Zoom, WhatsApp, whichever medium works best for you, and I answer your questions there. But I also talk to doctors and nurses directly so that you can make informed decisions, have peace of mind, control, power, and influence. I also represent you in family meetings with intensive care teams so that you have clinical representation and advocate, and that you don't get walked all over, because I know what questions to ask. I know how to manage intensive care teams. I've worked in intensive care / critical care for over 20 years in 3 different countries, where I also worked as a nurse manager in intensive care for over 5 years. I have also been advocating and consulting for families in intensive care at intensivecarehotline.com for the last 10 years. You can have a look at our testimonial and case study section for outcomes and results. We also offer medical record reviews as part of our membership in real time, so that you can get a second opinion in real time. We also offer medical record reviews after intensive care if you have unanswered questions, if you need closure, or if you are simply suspecting medical negligence. Now, if you like my video, subscribe to my YouTube channel for regular updates for families in intensive care. Click the like button, click the notification bell, comment below what you want to see next, what questions and insights you have from this video. And share the video with your friends and families. And once again, thanks for watching. This is Patrick Hutzel from intensivecarehotline.com. Check out our website, and I will talk to you soon. Take care for now.